in. Come in. Make yourselves at home. If you can.
I'm so sorry we're late. We had the devil's own job with the lock.
I think you know everyone here. Ladies. Gentlemen. You've asked me to chair this 7th plenary session of the laboratory animals, denizens of this contract research laboratory.
Oh, get on with it, Patience. None of us has got that long.
That's right, Paranoia. What's the point of plenary sessions anyway? We'll all be in a plastic sack when they've done with us.
Now, you two, this is not easy for any of us. And Paranoia, you might do yourself and your condition a lot of good with a rather more positive attitude.
Oh, he's right, morality. None of us has long to live, and we all take great risks to hold our little parliaments. God knows we must try and come to some resolution about how we might petition the humanoids for a better life.
Are they so bad, these humanoids? Listen, they feed us, care for us. We owe them everything, really. Treat the humanoids with respect and they'll look after us. You'll see. Oh, appeasement! A stomach full of weed killer, that's my daily dose. And do you call for respect?
I know, Defiance, but reason this through. I think, Appeasement, you were partially right. You see, my friends, we live in the grace of this humanoid world, and we must live in trust that their power over us is for some greater good, which we may only dimly understand, even though their ways do sometimes cause us hurt. Trust? They haven't started experimenting on you yet. Look what pesticides do to guinea pigs like me, and I can't stand it much longer.
As far as I'm concerned, torture is torture. Full stop. There are no degrees of torture because of some greater good or because A is not suffering quite so much as B. No, we're all suffering equally and we've got to fight it. That's it. Simple.
What do you mean, Defiance, suffer equally? How do you think guinea pigs got their name?
They really can't be that unreasonable, can they? Well, we should ask them nicely, perhaps with a bit of give and take. You must be as blind. Oh, sorry, Appeasement, I forgot for a moment. But can the pain we all suffer come from any sort of reasoning? No, it can't.
Well, I wonder if I might shift the debate on a little. We know that we suffer different ways, different degrees, maybe.
Humanoids!
I knew it.
One of them must be working late.
We've got to stop this. We'll all be found. No, we've agreed to take these risks. Patience, go on.
Anyway, should we presume that by experimenting on us, the humanoids might be able to understand their diseases and predict the effects of chemicals on their species?
Oh, yeah! Because if that was true, then we should respond to the chemicals in the same way as they do. But we don't because, I don't know, tens, hundreds, thousands of my forebears were given cancer to try out 2 drugs, estrogen and prednisone. Oh, yes, they worked fine on the humanoids, but did nothing to stop the cancer they'd given us. Nothing at all.
And come to think of it, didn't they already know that tobacco smoke caused lung cancer in humanoids at least 35 years ago? Do you remember they tried for years to give countless mice, rabbits, and other animals cancer by making them breathe tobacco smoke, but none of them ever got it. So then they thought they'd got it all wrong and smoke wasn't the cause after all. They even delayed putting health warnings on cigarettes. Well, we all know the rest of the story, don't we? Oh, dear.
And what's the name of that dreadful humanoid condition they've been trying to give to chimpanzees all these years? Are you awake, innocents? Wake up, innocents! What? Oh, help. I heard you. I was only just asleep. Oh, yes. Beginning with A, I think. Acne, angst,
Afterlife, annihilation,
anorexia.
atrophy, autopsy,
Oh, don't confuse me.
Asthma.
AIDS.
That's the one. They've been trying to give AIDS to chimpanzees since 1983, but we can't catch AIDS because we're just made differently, aren't we?
Quite remarkable. And now I come to think of it, aren't there lots of humanoid diseases that take quite a different form in monkeys? Malaria and strokes, I believe.
That's right.
May I come in here? Because am I right in saying that some chemicals have exactly the opposite effect in humanoids as they do in other species? Thalidomide produces birth defects in humanoids, but not in mice. With cortisone, it's the other way around. Morphine, although it excites cats, it calms humanoids. Paranoia, I know you.
And another thing, did you know that chemicals called leukotrienes are naturally produced in humanoids and dilate blood vessels when their skin's inflamed? So what can they possibly learn by giving it to guinea pigs when it does nothing but constrict our blood vessels? Answer me that one.
You know, they do use humanoids in their experiments, too. We came across a report during the last session. Yes, here it is. From the scientific journal Clinical Pharmacology and Therapeutics, which says that most of the harmful side effects that occur when new drugs are tested on humanoids do not show up in animal tests. Hang on a minute, appeasement. Most side effects when they start using these things on themselves? Yes. So that quotation from the American researcher Bernard Brodie is quite right when he says, oh, how did it go? That it's often a matter of pure luck that animal experiments lead to clinically useful drugs. Frightening, isn't it?
I'm glad you're beginning to see things our way, appeasement. Remember hypochlorite bleach, which only mildly irritates a rabbit's skin, but severely irritates the skin of humanoids? Is that why you stick up for them? My friends, if we really do respond to drugs and diseases so differently from the humanoids, and the humanoids are really as clever as we suppose they are, then it follows that there must be some other, more benign reason that makes their experiments so imperative, even if, as I said before, we can only guess at what that reason is.
Well, thank you, Morality. I think you've made a very conclusive argument, only I'm not too sure whether it's conclusively for or conclusively against.
No, you must agree it would be futile to conduct so many animal experiments, if indeed their bodies really do respond so differently to our own, well, wouldn't it?
Well, maybe, but suppose there is no better way of carrying out their research.
Oh, but patience, there is. Where have you been all this time? Tell him, appeasement, what you told me the other day. Well, it's really rather simple and uses no laboratory experiments. It's called epidemiology. They study the lifestyle and environment of humanoids in order to discover the underlying causes of disease. Then they know how to prevent humanoids becoming ill. That's it, really. Historically, I believe, it was clean water, hygiene and improved living standards that were chiefly responsible for reducing deaths from humanoid diseases, not drugs or vaccines. Well, you know how dirty they can be. Quite! But go on! Which diseases? Oh, TB, bronchitis, pneumonia, influenza, whooping cough, measles, scarlet fever, diphtheria, smallpox, cholera, typhoid, dysentery. You see, deaths from these diseases were already very much lower, and often a long time before any drugs had been discovered. You see? And these days? Well, all I know is that the main causes of the killer diseases in humanoids, such as heart disease, cancer, AIDS and strokes, have all been successfully identified by epidemiology.
No laboratory experiments even on humanoids?
Apparently not.
Oh, yes, they do, but only when they're dead, so it doesn't matter then much, does it? But they still torture us when we're alive. Remember diabetes? They knew from post-mortems on humanoids that it was a damaged pancreas that caused diabetes, but then ignored the evidence for years because they couldn't get the same results in dogs. You ought to know about this, Patience.
Aye, I did hear.
And Parkinson's disease. It was post-mortems on humanoids that identified this chemical imbalance in the brain, not experiments on us. Whatever will they think of next?
Go on, appeasement. Tell them about clinical research, then. You're hectoring me again, Defiance. I'm doing my best. Apparently, they carefully observe humanoids who are unwell. They take samples of blood, urine, and tissue for analysis and measure things like blood pressure. They can even take pictures of their insides using scanners. Lots of illnesses can be prevented or cured as a result of discoveries made through these studies of humanoids. For instance?
I'll tell you. Hepatitis, appendicitis, rheumatic fever, typhoid, ulcerative colitis, and hyperparathyroidism for a start. Oh, and all sorts of drugs they've discovered from tests on humanoids, such as anaesthetics, important heart drugs like digitalis and quinidine, and painkillers like morphine. You know, I just can't get out of my head that quote from the American Journal of Medicine. Progress by the study of man is by no means unusual, something, something, something. It is more nearly the rule. Not much consolation for us, is it?
Is that evidence enough for you, Patience? And aren't there even more sophisticated alternative tests? I'm sure Innocence will know. Hey, wake up, Innocence! You're the advanced mammal round here. Tell us about their dishes experiments, if you don't mind coming down from your evolutionary tree.
Oh, come on, Defiance, lay off.
Oh, I can't stop sleeping, sorry. Dishes, it's not a problem. It's called in vitro research, and they can now keep alive, in the laboratory, all sorts of humanoid cells, skin, tissue, and these continue to react to chemicals and drugs in a similar way as they do in a humanoid's body. It's really very clever.
I have to say, I find this extremely disturbing. Tiny scraps of humanoids in laboratory dishes? What do they do with all these bits?
Oh, many things. They test if chemicals are toxic, whether drugs work. They test for harmful side effects. And they can actually create vaccines and monoclonal antibodies on humanoid tissue now.
And these tests, do they work?
Oh, yes. Some experimenters now say they're more reliable than animal tests. They're very often cheaper. Oh, and often much quicker, too.
This is beginning to make me very angry. I had no idea.
Yes. A lot of university and industrial laboratories are going over to these tests. In America and Europe, mainly.
So what's the catch, then?
I don't really know of any, but they'll have to do more and more in vitro work because even just the possible cancer-causing chemicals waiting to be tested would take 80 years to test on animals like us. And that takes no account of the 500 or so new chemicals that need testing every year. So?
So they just have this compulsion to go on experimenting on us. I mean, even if they could do it all using their fancy computers, they'd still go on torturing us, wouldn't they?
Oh, but they do use computers too.
Oh, no, I don't believe it.
Oh, yes. They discovered that humanoid tissue only reacts to a chemical or drug if the shape of the drug molecule fits together with the shape of the cell molecule in the humanoid tissue, rather like this. So don't tell me. The computer can compare the molecular shapes very quickly, and then they know which drugs are worth developing further. That's roughly it.
Oh, no. All that, and it's just inside a computer.
Well, I'm afraid I really can't say I follow the details of what you've all been saying, but...
Look out! Humanoids!
What are you doing in here, guinea pig?
I knew it! I knew it! I knew it!
Oh dear. It is in difficult moments like this that we should try and think positively, to look to happier times. His departure will not have come as a surprise to him. Someone who was, perhaps, never quite at peace with himself.
Morality. I reject this notion.
Please. I think we're all a little upset. Perhaps we should try even harder to agree on some course of action. It seems that these tests on animals like us would be hard to justify if, as we think, the alternatives promise so much. Appeasement. You wanted to say something?
This is too awful. It makes me quite sick. But suppose this is all a matter of convenience to the humanoids. Perhaps we are just disposable. Haven't I always said so? No. Perhaps non-animal research, like clinical research, might just involve more work for them. Perhaps greater skills to avoid risks to their fellow humanoids. Perhaps it's just a whole lot easier to assemble 100 rabbits than 100 little bits of human tissue in a laboratory dish. I simply don't know. It was just a thought.
Go on, Appeasement. This may be interesting.
Well, it's got all the signs of humanoid inertia, hasn't it? Then suppose the humanoids have their own parliament, like ours. And then there were other parliaments around the world, and somehow together with the scientists, they'd all just got into the habit of using animals for experiments, you know? That's ridiculous! They must be responsible for their own actions, damn them! Are there no humanoids out there who are trying to put an end to all this on our behalf? Somebody's got to stop this merry-go-round of cruelty.
This is very true, Defiance. If things are to change, it will be because other humanoids are prepared to stand up for what is right. Demand a more ethical and reliable approach to science.
Look out! Humanoids!
Not another. What's going on in here? It seems there is nothing more we can usefully say at this stage. Perhaps next time, we must persist, make a better case.